So OlympiAD was a randomized phase 3 trial of olaparib compared to conventional chemotherapy in patients who had inherited mutations in BRCA1, BRCA2, and had failed prior anthracycline and taxane therapy. All patients were HER2 negative, could have been hormone receptor positive, could have been triple negative. And what we showed was that there was a statistically significant improvement in progression-free survival with no, as yet, improvement in overall survival, at least in a preliminary analysis, with preservation of quality of life across the subsets. So one of the questions that came up was, well, are people going to do better if they have more disease versus less disease? And this analysis that we presented here looked at the benefit in patients who had one metastatic site versus more than one metastatic site, and it appeared that there were similar degrees of benefit in each. And this is relevant because, you know, the question comes up as to, well, if I have somebody with a little bit of disease, I'll give a PARP inhibitor. If I have somebody with a lot of disease, I want to give chemotherapy. And this doesn't suggest that that's a logical strategy. Even people who had significant disease burden benefited from the PARP inhibitor.